So we are now at the finish line of my last chemo. The side effects kind of hit me pretty hard this time when I was on the pump. I'm now off the pump for 2 days now, and that's when the mouth sores really start to kind of kick in. So I thought I would share a little bit about what has helped me, both when they come, kind of soothe them and get them to clear up faster, as well as what has kind of helped me prevent them from occurring or getting really bad. Because the first time I was not prepared. I just did minimal things thinking they wouldn't be very bad, and then they were bad the first time around. And so I kind of learned along the way a couple little things that worked for me, things that didn't work for me, and so I figured I would just share in case you are going through chemo and dealing with mouth sores. That has been my biggest side effect. I did have a few days of nausea, and then I got really, really dizzy one night with chills and all of those things this round, but for the most part, the mouth sores have been the biggest issue. Usually they kick in about the day that I'm coming off the pump, so I've been on the chemo for 5 days at that point, and then the mouth sores kind of start to kick in. The first time it was sores. I mean, I had sores all in my mouth, on my tongue, under my tongue, all through here, everywhere, because I just didn't stay on top of it while I was on the chemo, and that's kind of what you have to do, is stay on top of it during the infusions so that it kind of prevents them from coming later on. Little change, because I had to grab a baby who did not want to be put down and then feed the baby, and now we're just holding the baby because she still does not want to be put down for nap. She just wanted to cuddle today, so I figure I'll finish this with her. But yeah, these are just some things that have helped kind of keep the mouth sores from getting really bad. My second and third round, I really only had mouth sores under my tongue. And I think the reason for that is because it's hard to get the ice under my tongue when I'm chewing ice. So it goes through the rest of my mouth, but my tongue kind of, only gets a little bit of it. But these were just things that helped me. And hopefully if they work for you, they will help you too. So the first time when I was in the hospital on my first infusion of chemo, my mom had gotten all the Biotin products. So you can get a kit that comes with, it's hard to hold a baby and show things at the same time, but it comes with the Biotin dry mouth rinse, a moisturizing gel, and then a spray. So when I was in the hospital, the only thing I was really using was the dry mouth oral rinse, and it does help a lot when you're getting the dry mouth. And so I would use it really only when my mouth was dry, but I would maybe recommend using it periodically just to kind of keep your mouth moisturized. I used it throughout that first round of chemo, and then my second round of chemo, I have slowly tapered off a little bit because it does work. It helps, but I read the ingredients and it's full of parabens, which I had been really trying to avoid. I don't usually use anything with parabens, didn't pre-cancer because, parabens are linked to causing cancer. So joke might be on me, but since here we are, but just obviously it's like almost gone. So I did use it and continued to use it because at this point it just helped, and it does work, but just know that it has parabens in it. And so if you are trying to avoid parabens, you may want to try and find a natural alternative to the Biotin. During my second and third rounds of chemo, I used the oral rinse like twice a day, and then I did keep the gel in my infusion bag to take with me for infusion day, and then I used the spray I kept it on my bedside table at night, and I sprayed it just if I woke up with really dry mouth, which I would spray it just to kind of coat my mouth enough just to give it the moisture that it needed without using a lot of it. So that is one thing that helps. If you find yourself needing it, the kit really is good. Like I said, it does work. It just has in the oral rinse, it has the parabens. The gel does not have parabens in it. It is glycerin, water, sorbitol, xylitol, carbomer, cellulose, and sodium hydroxide. And then the oral spray also is, nope, it does have parabens. It has methylparaben and propylparaben, and then a couple other ingredients, which you can see here. So that's one option. Once the mouth sores got really bad for me in the hospital, the pharmacist recommended Magic mouthwash, which is basically a combination of an antacid, like Mylanta or Maalox, Benadryl, and then lidocaine. And you swish it around your mouth. You can swallow it. I did that one night, and it did not work for me at all. It barely took the edge off the mouth sores I had. So that was what they gave me once I finally did have the mouth sores. This wasn't as a preventative measure. And even with the lidocaine, it didn't work for me at all. And that was a night that I got really, really frustrated because I was like, I just drank this stuff. I swished this stuff around my mouth. It didn't do anything, and I'm still in pain. My mouth is still just so sore, cracking. I had like a huge mouth sore right here. But it was the ones in the back of my throat that really just made everything miserable because you can't swallow. It hurts. And then someone who had gone through chemo before me recommended baking soda and salt. Literally just a baking soda and salt rinse. And I was like, there's no way that that's going to work. It's baking soda and salt, and this Magic mouthwash with lidocaine didn't work. How in the world is that going to work? I don't know how, but it does. My mom went and got baking soda and salt, put it in a little Tupperware for me, and I started using that, and it soothed it. But what it's really done is during my second and third and now fourth round of chemo, you want to do it multiple times a day as soon as you start chemo, basically. And it's helped prevent them from coming. Like I said, my second and third rounds, I did not have any real active sores other than underneath my tongue. Still had a lot of mouth peeling, just super uncomfortable, but not the sores, which was a huge game changer. And so literally it is just, I keep it in a bag so that it doesn't get moist because it does sit next to my sink. I keep it next to my sink in the bathroom, and it is a 1/4 teaspoon of baking soda and then 1/8 of a teaspoon of salt mixed in about, like I do 4 to 6 ounces of hot water. And then I just swish it around my mouth, gargle it, and I do that multiple times. I gargle with the rinse like 5 times. 5 to 6 times, about 3, 4 times a day if I can get 4. I don't often get to 4 because I just forget, and I only do it when I first wake up in the morning, at lunch, and then again at night. But if you can do it more often, do it, because it does work somehow for me. That was a huge game changer. And the salt, I don't really measure to 1/8. I keep this, I keep the salt, and then a 1/4 teaspoon measuring spoon in the bathroom. I measure off my 1/4 teaspoon of baking soda, and then I just kind of gauge, 1/8 is half of a 1/4, and so I just kind of gauge. If you end up using more salt in your rinse, it's really not a big deal. If anything, it's probably helpful. So quarter teaspoon of baking soda, 1/8 teaspoon of salt. Just mix it up, rinse it, and you're good to go. Get a soft bristled regular toothbrush to use during chemo treatments, because your gums are going to be super sensitive and sore. And so I try as close as I can to just brush my teeth. You do want to brush your gums, but do it really softly. The sucky thing is, you do want to stay on top of like keeping your mouth clean and brushing your teeth, but they're never going to feel clean during treatment because your mouth just feels fuzzy. Because for me, my mouth is peeling, my tongue is peeling. So even though my teeth are clean, my tongue feels fuzzy, which means that my teeth feel fuzzy because, that's what you run along your teeth is your tongue. And so it all just feels uncomfortable. Not the best, but, we just forge forward. And for me, the fuzzy feeling, it was different every time. The first go around, because I had the really active sores, it lasted, I want to say like 2 full weeks. The second time, it lasted about a week. And then the third time, I was really on top of myself, and I only had about 3 to 4 days after they really started kicking in before it started to feel like it was healing itself. So that was a huge win. I was very happy about that. I did also, with my third round, get this from my doctor, so you may want to ask about it. It's called Moogard, and it is a prescription mouthwash, very, very similar to the way the Biotine works. It coats your mouth. It's not like the Magic mouthwash. There isn't lidocaine in it, but it says, creates a protective barrier over the surface of the oral cavity to provide relief from oral mucositis, canker sores, and traumatic ulcers, coats and soothes. And it does do that. This was a sample bottle that I was able to get from my oncologist's office, and it has worked. And so what I would do is, again, the first night I started chemo, even before my mouth started to peel and get funky, I would use this before I go to bed and coat my mouth, and it really did help. I would, that one I would like put under my tongue and just like hold it there, just to make sure my underneath of my tongue was coated, because that was the place I continued to get the sores. And then I would hold it up so that it was touching the bridge of my mouth, and then I would gargle with it, and you can swallow it. I would only swallow about half of it. I would spit the other half out, but you can swallow it so that it'll coat your throat, because you'll get sores in your throat as well. That was a big thing for me. The second round was that my esophagus was torn up because I was also having really bad acid reflux. So, and I didn't realize that was what it was until they had done a PET scan and saw that it was my esophagus that was torn up. So you may want to ask for a prescription for a acid reflux medicine. They put me on pantoprazole, and so I'm on that, and that's been helping with the acid reflux, which has helped keep my throat from getting like as torn up as it was. And then at night before I go to bed, I drink a little bit of my Lanta before bed. So that's just another little tip if you find that helpful. But the biggest difference, I think, and what I was told was ice. Eat ice all day. When I was in the hospital the first time, I only ate, they give you, the hospital's got that crunchy ice, and they give you bucket loads of it, but I would only eat it when my mouth was really dry. And then my sister-in-law, who's actually a nurse at an infusion center, she said, no, you need to eat ice all day long, starting as soon as you start treatment, and just keep eating ice, because it basically works the same way like cold therapy gloves work for neuropathy for your hands. It tricks it freezes your mouth. So it does something into tricking your body into thinking that can't remember the science behind it, but you basically just have to eat ice as much as you can. And I like ice, but I'm not like one of those people who like loves chewing on ice. And so it can be hard for me sometimes to see my ice is right here. It's hard for me to want to just constantly have it in my mouth. But if you think you've eaten enough ice, you need to eat more. And so we got one of the nugget ice makers for the house. It was just an investment we decided to go with, and I'm glad we did because it makes chewing ice easier. You're not chewing, really hard, either crushed ice from the fridge or cubed ice that you're waiting till it gets small enough. The crunchy ice is a game changer for chemo treatment. I do know there's some chemos that can't do cold. It like shocks your mouth or something like that. So if that's one of the chemo cocktail you're on, I'm sorry. But if you're not and you're able to eat ice, get a nugget ice machine. The one we got, there's like, the big opal one that's like $500, but we were not doing that. So I found one that was way more reasonable. I think it was like $150. I'll make sure I link it as well as all this other stuff below. But get a nugget ice maker and then just eat ice like it's your life for however long you're on chemo. For me, I was on chemo 1 day in the infusion center and then 5 days at home. And so for those 5 days, I just ate ice as much as I could. And then right now that I'm off chemo, I'm still eating ice, just not as often because even though it does help soothe my mouth, it's also really cold. So I do it as much as I can, but I was slacking a little bit this round. And so I think that's why my mouth is a little bit more rough this time than it was my second and third rounds. And so that just showed me the ice does make a difference, because I was like, oh, it's okay. It's the last round. I don't need it. Like, I did really good the second and third rounds, but it was the ice that helped. So ice as much as you can. And I feel like this was a very long ramble on ice and mouth things, but hopefully if you're going through chemo and having issues with mouth sores, this can help you in some capacity. So, yep. Dry mouth rinse, no electric toothbrush, ice, baby. Ice it up. And baking soda and salt. Huge, huge help. So, all right. One more thing that I knew I was going to forget because I keep it in the pantry, but honey. And I ended up getting Manuka honey, and I'll share why. But in the hospital, I just had regular local honey because I always have honey with me. I am a honey girl, love honey, love bees. And someone had said use honey and basically put a spoonful in your mouth, coat your mouth, and then swallow it so that it coats your throat as well. And that really helped, especially when I had the mouth sores. It helped soothe things. But once I started doing what I could to try and prevent it, I would take about a spoonful, really when I would remember, but I would do a spoonful to coat my mouth. But I ended up getting Manuka honey because someone recommended it, because Manuka honey is almost like ranked on a medicinal grade. So this is MGO 400. This was a reasonably priced one I could find. It goes up to like 800, more than that, and it gets super expensive. I mean, there was Manuka honeys I saw on there for $100. And again, not within the budget I'm willing to spend. The difference between Manuka honey and just using, you can still use a regular local honey, but Manuka honey has really high antibacterial properties in it. It's from New Zealand and Australia, and where the bees, get the pollen to make the honey, it just has a lot more antibacterial properties. It's anti-inflammatory, and then high in antioxidants, which honey can have, but Manuka honey just has the extra kick for something like this. And so I went ahead and grabbed it, and it's been helpful. It's a little more grainy than regular honey, whereas, you know, regular honey is just kind of liquidy, golden. Manuka honey has, if you're familiar with like creamed honey, it's similar to that capacity. So it's thicker, it's, like I said, grainy, but it's been really helpful. So I just take a spoonful, put it in my mouth, let it coat my mouth, and then swallow it. And that's been another helpful, both preventative measure, and then once my mouth is torn up, a soothing measure. So I would highly recommend adding honey to your mouth sore arsenal as well. And now here I am breaking in with the extra clip that didn't get in yesterday before I even start the video in my PJs, because between mom brain and chemo cloud, I actually forgot what I think is one of the most crucial pieces that had helped with the mouth sores, and that is L-lysine. It's an amino acid supplement that really helps your skin, and especially the skin of your lips and your mouth. And so I've been using this literally every day, basically since my first day in the hospital starting chemo. This is, I really like the Solgar brand because they don't add a lot of additives to their supplements. But this one is 1,000 milligrams. The first one I was taking, my mom had picked up at the local, I don't know, Walgreens, but that was 500 milligrams, and I took that 3 times a day. This one is 1,000 milligrams, and I take it twice a day. And I do feel like it is a huge support and a huge help. So L-lysine, grab that to add to your mouth sore arsenal. One other thing I did want to mention that I forgot was I could always tell when it was really going to start coming on. It's kind of hard to talk because my mouth is a little tight, but I could always tell when it was starting to come on because I would have one day where my tongue would get really white. Like it was a sign to me that my mouth was really starting to kind of pick up with either the mouth sores or the really just kind of peely, fuzzy feeling, and then it would go away. But definitely make sure to watch that because you don't want that white to like end up all over your mouth and end up with thrush or yeast. It was not yeast or thrush. It just happened every time, and I'm pretty sure it was because my tongue was starting to peel the taste buds off, or just like the top layer of my tongue. So that's something that you will notice, and then everything tastes just like garbage because all your taste buds are messed up. But the whiteness, like, it's really not there anymore. It only lasted that one day, maybe a little bit into a second day. And then by that point, everything was kind of gone and rough and fuzzy. So that's just something to note, to look for. All right. I hope you found that helpful. Good luck and all the positive vibes on your journey. Bye.